Does platelet-rich plasma actually help improve skin quality and increase vascularity in scarred skin? Hello, there are a lot of reviews on here about PRP treatments, but most are from the 2009 to 2010 spread, when this was still a relatively new treatment. I was wondering, has there been any new studies done that can better assert whether or not PRP is worth the money? Any answers would be greatly appreciated.
Thank you for your question. You're asking if PRP really does help improve scarred skin quality and improve vascularity. And you state in your question that you've seen some studies from 2009 and 2010 when PRP was relatively new, and that you want to know if there are new studies. Well, I can certainly give you a perspective in this area. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have been in a leadership position when it comes to PRP for many indications. We use PRP in our practice every day and for a lot of different things. So I can certainly give you my perspective as someone who uses this every day. So I can understand, first of all, what your hesitancy is and your confusion is. Unfortunately, in the modern world, we are dealing in the aesthetic field with the with the kind of shifting of the way consumers receive information in a way that's comparable to the way medical doctors and pediatricians have been kind of usurped in a way by pharmaceutical companies. So just the way pharmaceutical companies will often advertise heavily and put information in front of people's eyes about new drugs before doctors are given an opportunity to learn about them, to test them, and see if they're right for their patients. Laser companies, device companies, injectables, these same billion-dollar plus companies will promote devices that are expensive and certainly offer a lot of things. What is absent from all that messaging is, of course, something as straightforward as PRP. Platelet-rich plasma has been around since the late 90s when oral surgeons were trying to help improve vascularity in bone when they're doing dental implants, as well as with orthopedic surgeons. And people who follow sports are very familiar with injured athletes going to places like Germany for PRP injections. Now, in the aesthetic field, because there is certainly plenty of opportunity to use PRP, there are certainly more up-to-date studies that support its value. But I can tell you first as a practicing physician who's actually using this material that I think that there is incredible use for PRP. Now, since you didn't submit a photo, when you make a statement like scarred skin, what I don't know is how scarred is the skin. I've used PRP with great success in acne scars. I've used it for thickened scars or hypertrophic or what people often refer to as keloid scars, but that's a different classification. I've used it for wound healing. I use it for skin complexion improvement. I use it for under-eye circles. And in combination with acellular matrix, we've actually developed a system for treating male and female pattern hair loss called hair regeneration, and we've even started a company called Tricostem Hair Regeneration Centers. So there is certainly no question in my mind of the value of PRP. But unfortunately, when you ask a lot of doctors about it, they know absolutely nothing. And what's particularly disheartening about that is that not only do they know nothing, but they're quick to disparage it. It seems that many aesthetic doctors in all levels of specialties, not just plastic surgeons or dermatologists, but all different specialties within the aesthetic umbrella, are quick to disparage anything that they don't know, and which does not help patients and doesn't help people learn about things that are of value. So what makes this open communication medium so valuable is that you can get information from experienced practitioners like myself who can give you some perspective. Since I have absolutely no interest in getting sponsorship from anybody, I just simply talk to my patients about the things that I use in my practice and how they work for me. So I would say to you that you don't have to question whether or not PRP has value in many different modalities, including the treatment of scarring. But you have to learn is it right for you? So I recommend you seek out a qualified, experienced doctor who does a lot of platelet-rich plasma treatment, who understands it, who uses it a lot, and has a familiarity with your condition. Once you find the right doctor, I can tell you that PRP is not a solution that works perfectly on everybody in the same way. There is an art to doing it. There's an art to when to do it, how much to do it, where to do it. There's a lot of variables. I think of it in many ways like surgery. I also think of it in many ways as an experienced doctor to use past experience to apply the knowledge to future patients. So with that being said, I think you just need to find someone that you're comfortable with and explore your options. PRP could be one part of a more global treatment plan, but certainly I think that there's no question in my mind in recommending it for a variety of modalities, and we use it, like I said, we use it in our practice every day. So I hope that was helpful. I wish you the best of luck, and thank you for your question.